Nurse Ralph has been a nurse in Manila for 2 years. Being a local, he had no difficulties with interacting with patients from the area or even from neighboring city. He loved being a nurse because of his ability to connect with patients easily. That is, until he received a patient who recently moved to the country and is from the East Asian culture.
Good morning, Mrs. Lee. How are you feeling today?
I'm doing good.
Okay, so I will be checking your vitals first. Alright, so your blood pressure is a little bit elevated. So I will be giving you medication to help lower it.
Oh, no medicine. Herbs are better.
But this is what the doctor prescribed. And herbs just won't be enough, Mrs. Lee. And I guarantee that this medication will help with your condition.
Mrs. Lee was very taken aback with Nurse Ralph's persistence. She looked very uncomfortable, which made Nurse Ralph feel a bit frustrated. However, he maintained his professionalism. He told Mrs. Lee that she was going to get something from the station, but he really just wanted to reflect on the situation.
Okay, so Mrs. Lee actually resisted the medication. Maybe it's not about the medicine, instead it's about her cultural belief. Maybe I should look more into it and ask her some more questions about her perspective. Hello, Mrs. Lee. Can you tell me more about your medication or the herbs you mentioned? Because I want to understand what you are comfortable with.
It's an herb from home. My mother said that it's good for the heart. My family has been using it for generations.
Ah, I see. Thank you for sharing that with me. I now understand that these remedy are important to you. Maybe we can talk to the doctor about some alternatives or about combining the medication and the herbs you presented and find a solution that works for you.
Yes, that will be okay.
Nurse Ralph learned that respecting cultural differences doesn't mean completely dismissing medical practices, but rather collaborating and finding a solution that fits both the medical framework and the patient's cultural beliefs. Nurse Ralph's understanding that the patient's refusal of medication stems from cultural beliefs rather than non-compliance highlights cultural sensitivity. Taking time to learn about the patient's beliefs and work toward a compromise shows cultural competence. We should also note the importance of effective communication, especially when language and cultural barriers exist.